Hi, I'm Jerry Waterworth, a volunteer with AARP Arizona in the Community Education Program. Today, we want to share some basic information about Medicare to help you navigate your Medicare choices. We know that making decisions about Medicare plans can be confusing and difficult, so we've created a series of videos to help you navigate the process. The good news about Medicare for this year is that Medicare Part B premiums will decrease to $164.90 in 2023 from $170.10 now. Insulin copayments will be capped at $35 per month. The Part D donut hole is now gone, and the cost of prescription drugs in the catastrophic stage will be zero starting in 2024. Medicare will now be able to negotiate prescription drug prices, and prices are expected to go down. And Social Security has added a cost of living adjustment in 2023 of 8.7% to the benefit. This is the largest increase in decades. The average benefit increase will be about $146 monthly. So if you're currently enrolled in a Medicare plan, it's a good opportunity to take a look at what you have in order to make sure your needs are being met. We're currently in open enrollment. This runs from October 15 to December 7 every year. And during this time, you can join, switch, or drop a plan. So check your mail for important notices from Medicare or Social Security regarding changes in coverage, costs, or service area. Also, your drug plan may have notified you of changes in coverage or their drug formulary. You should review the 2023 Medicare and You Handbook, your Medicare coverage, and your prescription drug plan needs for 2023. If you're happy with your current plans, there is no need to take any action. Also, you can get personalized help in the community. You may be able to find free information and events online or from Medicare counselors in your area by phone, like your state health insurance assistance program, which is run by the Area Agency on Aging. So let's review our objectives today. We're here to provide basic information on Original Medicare, and our discussion topics will be Part A, hospitalization, Part B, medical care, Part D, which is prescription drugs. We'll go over what is not covered by Medicare. We'll touch on Medicare and other insurance coverage, and we'll look at Medigap or supplemental insurance. So let's review traditional or original care. Original Medicare has several, starting with Part A, which covers hospitalization. That is inpatient care for hospital stays, skilled nursing care, hospice care, and home health care. The good news is that if you've worked for 10 years and have 40 credits with Social Security, Part A is already paid for and there is no additional premium. There are costs when Part A kicks in that you should be aware of, including a deductible per benefit period of $1,600 and co-payments based on the length of inpatient care. Part B covers medical care from doctors and specialists, outpatient care, durable medical equipment, and preventive services. There's a current base premium of $164.90 monthly, which is a slight decrease, as we mentioned, from 2022. This premium, though, is means tested, meaning that those with higher income may pay more for Part B. There is also an annual deductible, and be aware that Part B requires coinsurance of 20%. That means that Medicare will pay 80% of normal bills and the patient will be charged 20% of the service. That may add up quickly, so we'll touch on Medigap insurance in a second, which can be used to cover those out-of-pocket costs. Part D covers prescription drugs through private insurance companies. Now, premiums for Part D can vary widely based on the plan select, and most plans have an annual deductible, which can vary. There's also coinsurance, which is an out-of-pocket cost based on annual spending, which is tracked for you by Medicare. Generally, the coinsurance is 25% of the drug cost up to the catastrophic level. And now, as we heard earlier, we'll be dropping to zero after that. But remember, coverage can vary widely based on the plan selected and the formulary of that plan. So it's important to select the right plan for your situation. Please be aware that some things are currently not covered by Medicare, including long-term care, most dental care, dentures, eye examinations related to glasses, cosmetic surgery, and good news, acupuncture is now covered in some cases for chronic lower back pain. Medicare does not cover hearing aids and exams for fitting them, as well as routine foot care. You might keep in mind that if you are not yet on Medicare and have other private or employer insurance which covers these things, you might get these treated before you sign up for Medicare, and you could save some money. Medicare will coordinate with other insurance you might have, including employer insurance, union coverage, VA services, TRICARE, or federal insurance. Medicare serves as primary coverage in some cases and secondary in others. Now let's talk for a second about Medigap. With original Medicare, you have the option of purchasing supplemental insurance, or Medigap, to cover certain out-of-pocket costs. Medigap will pay for deductibles, co-payments, and co-insurance under Part A and B. But please be aware there is a 6-month pre-existing sign-up protection, which means that when you originally sign up for Part B, you have 6 months to enroll in a Medigap plan with no questions asked. If you have any pre-existing conditions, please be aware of this open window for enrollment. Now, there are many different Medigap policies to choose from provided by many different private companies. Benefits are standardized by the type of plan chosen, and unless you already have an F plan, most out-of-pocket costs can be covered except for the Part B deductible. So that's a brief summary of original Medicare, covering Part A, hospitalization, Part B, medical insurance, Part D, drugs, and Medigap or supplemental insurance. If you're currently enrolled in a Medicare plan, it's good to occasionally take a look at what you have in order to make sure your needs are being met. And this is the time to do it during open enrollment. Now, for help on plan selection or additional information, you can contact the State Health Insurance Assistance Program at 800-432-4040, the Area Agency on Aging at 602-280-1059, the Medicare website at medicare.gov, or by phone at 800-633-4227. You may contact Access or Medicaid in Arizona at healthearizonaplus.gov, or by phone at 855-432-7587. And you can also look at the AARP website at aarp.org/Medicare Q&A for answers to many of the common questions about Medicare. You may also call 888-687-2277 to speak to a live person. So thanks for joining us today for this overview on original Medicare, part of our series on Medicare topics to help you get more informed and be better prepared to make proper Medicare decisions for you. We hope you found this useful, and we'll look forward to seeing you again at another taping. So goodbye for now.